One and all, welcome back to the today's session. Today we have our guest speaker, Dr. AJAYAN sir from Professor, Department of Practice of Medicine, Sharda Krishna Homeopathy Medical College, Tamil Nadu. So today's topic will be an insight into the utility of Knerr repertory and its correlation with clinical examination. We welcome you, sir. We welcome you all the participants to the today's session. Session is all yours, sir.
Okay, thank you. Now it's audible?
Yes, sir.
It's
You are
audible?
absolutely audible, sir. Yes, sir.
Okay.
Yes, sir.
Good evening to all. Respected those who are arranging this program, the organizers, then my dear friends and doctors. First of all, let me express my sincere thanks to the organizers give me opportunity to present a topic related to Knerr repertory and its clinical correlation in this webinar series. You know, then here the introduction, that means the topic is an insight into the utility of Knerr repertory. Everybody in their practice using this Knerr repertory. At the same time, the number of the doctors use the Knerr repertory in their practice is very less. Because so many limitations there, but at the same time, so many advantages there. But this particular session, I would like to highlighting the importance of Knerr repertory in our clinical practice. You know, the officially titled the Knerr repertory is the repertory of herring guiding symptom of our materia medica. It's a comprehensive and a specialized tool in homeopathic practice. It's actually compiled by the Calvin B. Knerr. It is correlated deeply with the herring's vast the compilation of materia medica. Its utility in clinical examination lies in its ability to bridge the symptomatic finding with the specific remedies. It will aiding the practitioners in precise case analysis. Here an insight into its utility and its correlation with the clinical examination. But here, the clinical examination, I more emphasize the role of physical examination. Once again, I say here in clinical examination means I emphasize more concentrating on physical examination. You know, I'm a practice of medicine teacher. In my day-to-day practice, then role of the practice of medicine subject is the first one is the diagnosis of the disease. This time I am remember the words of our philosopher, Dr. H. Robert. That says the aim of the homeopathy physicians are two. The first one is the diagnosis of the disease, and second one is the diagnosis of an individual. One more, then just I collected information from your side. How many hours, please, anyone, please say how many hours for this session, please? 1 hour
Sir,
or
it is a 1 hour session, sir.
1 hour
8:30
session? Very good.
Yes,
Okay,
sir.
okay. Well and good. Okay. You know, the first one is the diagnosis of the disease. Then second one is the diagnosis of an individual. But
sorry to interrupt, sir. Actually, slides are not moving accordingly, sir.
now this time is not moving. I'm going to introduction. Okay. Please wait. Now it is moving.
No, sir.
Now it's moving.
Yes, sir. Absolutely, yes, sir.
Please wait. After introduction, okay. The aim I already conveyed with you. The first one is the diagnosis of the disease, and second one is diagnosis of an individual. So listen here. This slide shows the breaking the bullseye. That's our aim. Then suppose a patient in our clinical side, our aim is to collect uncommon peculiar characteristic symptoms. If we are collecting uncommon peculiar characteristic feature, definitely we are able to break the bullseye. That means even irrespective of the pathology, that means reversible or irreversible type of pathology is there, then suppose we are collecting uncommon peculiar characteristic feature of an individual, definitely we are able to break the bullseye, means we are able to cure the case. Then again, you listen here what the picture shows. That is a bird. That is an hunting. We are trying for the hunting the fish. Then suppose a patient in our clinical side, we are reach or in IP ward, we are during the time of rounds, we are visit a patient. Our intention also is like this. We are hunting the symptom, hunting the uncommon peculiar characteristic features. Therefore, we are need certain preparations. This bird, for the hunting of fish, here certain preparation is there. Then just then both wings are here maintained in right position. Then one leg is moving in or forward. Then the beaks, you look the eyes. Then a sharp vision is an object is there. Then with the help of the beak already there open, that means that bird then fit for this time, fit for then hunting their food. That means that fish. The likewise, a physician approach a patient with the help of their knowledge. That means the preparation, the knowledge. We are hunting the characteristic feature of an individual. Definitely, we are able to cure the case. Then I am not going to the details of all these things because only limited time, that is 1 hour. Within the time, I am not able to complete the entire slides, but I am trying in our best level. You know, then is in our master says, then physician hand only mission to restore the sick to health to cure, as it is termed. Everybody know. Then listen, as a homeopathy physician has to make double diagnosis. Then there's a word I highlighting double. Then the homeopaths need double brain. Double brain here means one is the materialistic. Everybody have their own brain is there. That is a materialistic brain. And second one is we are developing another brain. That means through our educations, that through the entire period of the educations, we are trying to understand what is the exact homeopathic science, the rich, the philosophical concept and the mathematical knowledge and repertory knowledge. It will help for to treat a case. That time the case successfully treated with homeopathy medicine, that medicine act as a curative in nature. That time that medicine we are called it as remedy. Therefore, I like to highlighting all the homeopaths need double brain. One is the existing our material brain, and second one is the rich knowledge about the homeopathic science. That is immaterialistic brain. That is called individual brain. Individual diagnosis. Therefore, we are make our diagnosis in two different level. One is the disease diagnosis, and second one is the individual diagnosis. Individual diagnosis means the naming of a disease. Then in modern scientific era, then each and every disease can diagnose by investigation. Some of these are not cost effective and painful to the patient. Even then, there are many diseases which remain undiagnosed. Their symptomatologically plays important role. That's another advantage of homeopathic science. Even the diagnosis is doubtful. Even diagnosis is not able to diagnose the case. In case of few kind of patients like imbecile patient, the deaf and dumb patient, in case of children, we are not collecting the subjective level symptom. At that time, the right way, we are not able to diagnose the case. That even we are believing the symptomatology, we are believing the symptomatological diagnosis, we are right way, we are able to select right homeopathic medicine. That is the advantage of homeopathic science. Then listen, in homeopathy, we are make double diagnosis. One is the disease diagnosis and second one is individual diagnosis. Then investigation also in two different level. One is the individual investigation and disease investigation. Disease investigation, everybody know. The time a questions we are raising, what is an individual investigation? in our day-to-day practice. Suppose after administration of a remedy, then can observe 12 findings. That is one of the individual investigation. Then again, then after administration of remedy, then medicines are producing some aggravations. Then sometimes the disease also shows aggravation. Sometimes then a medicine acts as a remedy. That remedy is makes some aggravation. That is called it as homeopathy aggravation. All these are the kind of a type of individual investigations. Then remedy reaction, primary action of a drug, the secondary action of a drug, all these are under individual investigation. Then suppose that means after administration of remedy, a good homeopathy doctor, they are work out whether the case medicine is producing any one of these finding is present or not. That is under individual investigation. Then again, the last one is the management. Management also everybody know. I am a practice medicine teacher. After the diagnosis, we are make the right. We are suggest. We are convey the patient with the right disease management. Everybody know. For example, in case of diabetes mellitus, we are restrict the carbohydrate food. The likewise here, another one more management is there. Is very essential. That is individual management. Individual management means then fully belongs to diet and regimen. Then the disease diagnosis, the symptom and sign is and investigation help for the disease diagnosis, individualistic diagnosis, like symptom, sign, and individual investigation. Here the symptom means individual symptom. Here the sign means individual sign. Here the individual investigation. Individual investigation I already conveyed with you. Then for what purpose we are concentrating all these things? That is the first one is here we are discussing the herring guiding symptom, the Knerr Repertory. The herring in their life history, they are explained about when the cure established, then so many characteristic features, especially when an acute disease, the curing, at least it will show the 5 qualities. The first one is the limitation of the usual course of the disease. Then second one is the perceptible moderation. That means the patient, the full arrest the pathological products. Then third one is rapid recuperation of the strength. That means the patient retain the normal vigil. And fourth one is the removal of the tendency of the relapse of the disease. And last one is the first changes happen in the mental state of the patient. Then here I know that few group of the students are attending this seminar and few doctors are also attending this seminar. All of these doctors and students are aware about the curing procedure. Then acute cure is a procedure and chronic cure procedure is both are different. Then chronic cure everybody know, from center to periphery, higher important organ to less important organ, then high pathological organ to less important organs, etc. These are everybody know. But these are the 5 qualities related to acute cure. Yeah, acute disease, the curing, at least producing this quality, these 5 qualities. So once again, I repeat, first changes happen the mental state, then patient is within a short span after administration, short span of time, then patient is retained the normal vigor, and then time duration is limited, then total arrest the pathogenesis. That means the pathogenesis means mechanism of development of disease. Remember one example. You think the pneumonia, there are 4 or 5 stages is there. Suppose a patient in stage of congestion, a right homeopathy medicine you are selecting, never this patient tends to gray hepatization. Then suppose a patient is arrived at the stage of gray hepatization, the red hepatization never tends to gray hepatization. That is our policy. That is the best example for when an acute cure establishing, definitely this feature is there. Okay, then what is the symptom? Then is Hahnemann describe about the deviated the force and that time the manifestation in mental, emotional and physical level is there. That is called symptom. Then symptom, then commonly we are used for the diagnosis. It will help for the prognosis, and it will help for the remedy selection, and also it will help for to finding or identifying the right miasmatic background of the patient. These are the types of symptom. The body has explained about the symptom location, sensation, modality. The Hahnemann also explained as a general symptom. The Dr. Gartenborg, that is basically says a basic symptom. I'm not going to the details. Dr. J.T. Kent is a patient as a concept, as a whole. That is first importance given to mental generals, then physical generals, then particular, then common symptom. Then again, Constantine Herring, the first important for the guiding symptoms. Then our Knerr Repertory also based on these guiding symptoms. Then in clinical presentation, all these symptoms are two different levels, either subjective or objective. The subjective means vocabulary, one language. If the patient says a subjective level symptom. Objective, everybody know through the examination or the physician observation or the data is collected from bystander. It's an objective symptom. I'm a practice of medicine teacher. Then here more importance given to physical examination. Then you know a patient is arrived in our site. Then after collecting the data in basic information from the patient, then history, everything we are collecting, and immediately we are examine the patient. We are conduct the general physical examination, including systemic examination, finally regional examination. Then here the objective level symptom collection means that through these three different levels, that means general, then systemic, and regional examination, we are collecting the disease symptom and characteristic symptom. Okay. Then symptom and subjective and objective we are already discussed. That just to is not a is an online platform. Therefore, I am not asked the students to please highlighting what are the symptoms. I'm just to show few video clippings. That through these video clippings, just to collect that what is the objective, what are the objective finding you are seen in that case. If you are able to, I'm not this time not able to work out. Even you are chatting, I am not able to work out. But just to try through the chatting, just to try to collect few characteristic objective level finding in each and every case. Okay, just to go through this case, please observe and you say what are the characteristic examination finding. It's a case of an autism child in clinical site presenting this a feature. Then always while visiting, then always this child shows this presentation. It will help for the selection of homeopathy medicine. Okay, and the sitting with the legs crossed. Then look this 80 years old lady. What is the observable symptom? What is the observable symptom?
Sir, you can check it the answers in the question mark symbol, sir, so that they can put it in the chat box, sir.
Okay. Then another one more case. Look here, is a case of inguinal hernia. A child. The surgeon immediately advised for a surgery. But his presentation is like this. Look here, a child left leg flexed towards abdomen. Is right. Then just look the toes. Then look the scrotal area, the extension of the herniation. Look here. Okay. Then that previous slide video clipping is a case of inguinal hernia. That is, an herniation is there. Then surgeons are advised an immediate surgery, but the parents are not willing for surgery. Therefore, you are visit for the homeopathy. You are just to consult homeopathy science. Consult with the homeopathy physician. Their observation is this one. Okay, I'll discuss later. Is another case of a chronic constipation, a child, we are entering the room, the child presentation is like this. Now look here, the near to the door, we are trying to open the door. And after that, the child is crying. Okay. Okay. That is irresistible desire to open the door. It's a case of another case. It's a positional vertigo. Look here, but she is only lying with on a particular side, but she is not able to move her head. Okay. Then listen here, another child isn't suffering from an acute appendicitis, but he is always covering. But the legs, they are keeping the legs position, just you look. He is not able to extend both the legs. Both the legs are crossed. Okay. This is another case. Now listen, all these cases, I am not trying to collect any subjective level symptoms. In all the cases, with the help of these objective level finding, objective symptoms, I am trying to collect the correct homeopathic medicine from our repertory, Knerr repertory. For all these cases, our Knerr repertory is helpful to show the right rubric. That is the importance of Knerr repertory in our day-to-day practice. Is the correlation of objective symptoms through the physical examination. You know, physical examination or medical examination or clinical examination is the process by which the medical professional investigate the body of a patient for a sign of a disease. The aims and objective we are already discussed with you, like after the collection of the subjective level symptom, with the help of our physical observation and the palpation or percussion or auscultation, we are trace out then patient, the related disease-wise finding we are work out. That is an aim and objective of our physical examination. All these we are help for the diagnostic, or we are same time we are converted to the for homeopathic point of view. That means a homeopathic physician, any objective level findings, you are simultaneously used for the diagnosis and as well as you are used for the selection of a homeopathic medicine. Then here the above all the videos, these observable findings, I am never neglected. I am trying to work out that observable finding we are able to see in our Mathematica or in our repertory. I am searching. While searching, I am able to work out all the rubrics, all the symptom related rubric I am work out from our textbooks. Okay. The origin of the history of the physical examination, then Hippocrates, their contribution, all these scientists, their contribution is there. Lennox, that is an invention of the stethoscope. Then all these eminent doctors, their contribution is there. Then physical examination, homeopathy philosophy, the H.R. Robert says, I already convey with you. He says the serious infections were cured before the laboratories were a hand to furnish an accurate diagnosis. And it very often to most prominent result of a lab diagnosis is weaken the courage of the physician. That means he is highlighting the importance of the symptomatology. That means the symptom, the subjective and the objective symptom. The Henneman also in their aphorism 6. He says the role of, that is an always a homeopathy physician as an unprejudiced observer. Then again, the tuberculosis also says about there is also a reminder that there is more in an objective symptom than the perceptible to the eye alone. That here you know the importance of objective level symptom than the subjective level symptom. The subjective level symptom always the present by the patient. The patient sometimes we are misguiding then through the subjective level presentations. But unwanted symptom there may be the highlighting. The important symptom for the homeopathy purpose, they are not able to highlight it. But at the same time, importance of the physical examination, that means the collection of objective level symptom, then always a physician is look the case, work out the case, and collect the symptom. A physician, homeopathy physician is an work out the symptom, then for our purpose, related symptom only collected from the patient. That is the beauty of the objective level symptom. Therefore, the objective level symptoms always shows the right characteristic. Therefore, never neglect the patient if they are presenting a objective level finding, objective level presentation. A patient, a objective level, a presentation is there. You give the higher mark. That is my request. The Lipisu is also here. He is also highlighting the importance of objective level symptom. The Elizabeth writes, that means and almost our philosophers and stalwarts, they give the importance of the role of the physical examination. That means the collection of objective level symptom. Then objective levels, how you collect the objective level symptom? That means smell, odor, under inspection, even the touch, the body of the patient through. That means the relationship with the physical examination, palpation and percussion. Then listening the sound with the help of the stethoscope. That means the auscultation. We are able to work out the right characteristic of the patient. Then I am work out the few smell and odor related symptom we are collected and your repertory. The number of medicine is there. Then sound and listening, again number of medicine is there. Then inspection while seeing, again body language, facial expression. Then just we can work out and it shows the number of medicine. The touch and palpation. So just look, this patient who is complaining to the left side of chest pain may enter the clinic with one hand over the chest, which may help to the physician to think of the condition. Everybody knows an angina pectoris. It's a classical presentation. The patient always bend forward towards the left side and with the help of the hand, the hold the retrosternal area or the chest. Then that patient always presenting retrosternal pain. That the look here is will help for the diagnosis. The pain over McBurney's point is an appendicitis. Then Murphy's sign is a classical feature of cholecystitis. Then glossitis. Individual diagnosis. That means it will help for selection of the homeopathy medicine. There are perceptible through their workout, the personal appearance, then gestures, posture, facial expression, eye expression, voice intonation, touch, etc. Then the key benefit of the body language, everybody know. In beginning, I will convey with you is physical examination or objective level symptom, more benefit for if you are one-sided cases, then psychiatric illness is there, somatic difficulties, then pediatric cases, then contradictory or ill-defined data in tough and dumb imbecile cases for clinical diagnosis of the case. Then again, it will help for understanding the inner personality, for selecting the rubric with the help of the body language. Then just you look the importance of observation in remedy selection. This and I would like to correlate it with the materia medica. The field of materia medica, the patient are not different from another. There are two sides of coin, the study of the fusion process. Look here, then a lachesis patient always is an excited, inquisitive, that is constantly asking question, loquacity, then appearance wise we are able to work out. Is a body language wise, look, the eye expression, rubbing always. Then few drug, the calcarea force, lycopodium, alumina, the platina, lachesis, plumbum met, etc. Then always the eye expression rubbing. This characteristic feature is there just to remember few this type of medicines. Then listen, eye expression sleepy, drowsy. Medicines are antimonium, tartaricum, gelsemium. The gelsemium everybody know 3D and T, business dullness and drowsiness, borax, phosphorus, plumbum met. The famous film actor in Malayalam, Mohanlal, then facial expression in few cinema. You are already look this facial expression anxious. That few drugs are we are mentioned here. Start from aconite and veratrum, end with veratrum album. Few drugs are there. I am not the time is short. I have not read all the medicine scientist name. Please always just remember, or you should take a photograph, a photo. Then facial expression blank, always. The drugs like phosphoric acid, sepia, hellebores, veratrum album, etc. Then look here, the face of this lady, the facial expression, frowning disposition. Look, the frontal area, the forehead, always frowning, frowning. Lycopodium, Nexomica, Camomilla, Graphitis, and Natrum muriaticum. The face of this youth man, facial expression, idiotic. The Barretta carb, Calcarea carb, Bethusa, Barretta or tuberculinum, always pulling or tugging. The child always like this, their presentation. The few drugs are there, Barretta carb, Hellebores, but lachesis, opium, and symphatum. The look, the angle lock position is like while sitting, the ignition, natrum muriaticum, and phosphoric acid. Then listen, then previous a video clipping, the first video clipping, the like this presentation. Okay, you remember? Then cross their legs. The look, anacardium, coccygum, lachesis, lycopodium, nexomica. In this particular child, a autistic child, then out of these 5 medicine, one medicine help for me to select for the management of these autistic features. Okay, I discuss later. Then listen, this one is mouth lip compression. I will show you few patients video clippings. If the time is available, I will show you. Then look, the mouth lip pout, always a child in their life. Almost all are presenting like this. The look in our Metromedica, antimonium, crudum, ignatia, maltol, natramur, stabis agria, few drugs are also shows this particular finding lip pout. Then look, the mouth lip pursing lips. The number of medicine is there. That is, I would like to highlighting on important drug carcinosin. This carcinosin medicine shows all the 3 levels of contradiction: emotional level contradiction, mental level contradiction, and physical level contradiction is there. Okay. Then look, while sleep, I know the few homeopathy hospitals, even at night, when they are conducting the rounds, there is a like the why they are conducting the rounds at night. The reason is for this one. That because they are able to collect the characteristic feature while during the sleeping, the characteristic feature. Now it's audible? Okay. Then sleeping posture, the arm under the head width. Then belladonna, cochleus, platina, these are the few drugs. Then sleep posture forwards, hands with naxomic and stramonium. Then again, the sleep posture leg crossed with while lying, ambra gracia, beretta carba, and bryonia. The look, the sleep posture slide curling up. Iosemus lachesis nexomica. Then another, the ladies almost there sleep, this position, carcinosin medorinum, Nietzsche's position. Then physical examination related rubric in different systemic diseases. The listen repertory hearing aiding symptom or calvibin outer chest, barrel-shaped. A few drugs, sarsaparilla, only one drug is there. Then flat chest, intercostal space falling away, calicarb. Then inner chest, lung, rubric palpation. Inner chest, lung, auscultation sound, vocal fremitus is increased. Only one medicine, sulfur. The inner chest, lung, pleura. The vocal fremitus absent of with the plastic exudation, hepatic sulfuric. Then percussion related, everybody know physical examination, these are the procedure, inspection, palpation, percussion, and auscultation. To look, the percussion related number of rubrics we are seeing in this repertory. Inner chest, the percussion sound, the look here, the dull in left lobe down to third intercostal space. That is the beauty of the homeopathy science. Look here, their specification is very important. Down to third intercostal space. There is only one drug is there. Suppose dullness is there. You know the 5 basic percussion note. First one is flatness. Second one is tympanic. Then third one is resonance. And fourth one is dullness. And fifth one is hyperresonance. Suppose that dullness in left lobe near to the third intercostal space, this dullness is there. In this is only one medicine is a sulfur. Then why that you are selected medicine for hearing aiding symptom? The medicine is beautifully acting. Why I say reason is, then almost all the symptoms, the gating symptom means proving, reproving, verification, re-verification is there. Therefore, no doubt that medicine is working. The next, the dull beneath the left clavicle, only one drug is there, arts iodator. Suppose in our practice, that during the time of physical examination, you must, all the cases, you must conduct the physical examination. This is my request. I'm a practice of medicine teacher. You must utilize our examination table in our examination room. So nowadays, and almost the homeopathy doctors have never used the examination table. The examination table, they are used for some other purpose. But it's not good. You must utilize our examination table. If a patient is arrived in our site, after collecting the histories, immediately you are shift the patient to our examination table. Examination table help for you to select the right homeopathic medicine is my request. Look here. This particular area, dullness is there. You never think about any other medicine. You think about this only, this first medicine arts iodator. Rubric percussion related, dull. Listen here, the beauty of homeopathy repertory or homeopathy mathematica. Dull in lower 3/4 of the right side in pleurisy, only one medicine, Senega. Dull in front of fourth rib in pleuritis. The dullness in front of the fourth rib. That is the beauty of our mathematica. They are never that present. That presentation is there. Never you are omitted our drug cactus. Then you are immediately you are select the cactus. Then auscultation. Everybody in their practice, there is an identity of a doctor is and you are use the stethoscope. But we are put the stethoscope. We are used for it will help for the diagnostic purpose. My request is this auscultation you must utilize for the homeopathic purpose. Homeopathic purpose means the selection of a homeopathic medicine. I will show you few rubric. Egophony, one of the added sound. In right side towards upper part, only one medicine is a Senega. Egophony in pneumonia, Syncomet is a medicine. Amphoric breathing in tuberculosis, Natramarsh is a medicine. That means that we are collecting hundreds of symptoms from the patient, but this presentation is there, just few more importance given to this characteristic examination finding. Then bronchial breath. Then crepitation wise, the number of rubric is there and related, and also specific medicine is also there. The crepitation in left in pneumonia, antimonium tartaricium. Then previously I highlighting the cardiovascular system. Now I like to highlighting the respiratory system. But the time is only 10 to 20 minutes remaining. Therefore, I am shift to then another area. Then respiratory system also, the related inspection and related to palpation, related to percussion, related to auscultation. Number of rubric is there in our repertory. the number of medicine also there. Then here only I am highlighting are the symptoms are collected only from Knerr repertory. Okay. Because in my day-to-day practice, in my day-to-day practice, I am trying to collect the physical examination rubric from the different repertories. But unfortunately, in all the repertories, the few rubric is there. But more rubric I am work out in only one repertory is a Knerr repertory. In sometimes other repertories also we are seeing the physical examination related rubric. But in my practice, I am using this repertory because I am once again I say I am a practice medicine teacher. Then regularly I am visiting my library. If in library, their librarian also shows the new books are arrived in a separate table. They are keep all the new textbooks. Then one day I am visiting there. A big textbook is there in front of the table. A big textbook is there. That book there mentioned is like this. It's the reversed edition of the Knerr repertory by Shivaramakrishnan. I don't know. I previously heard about the Knerr repertory. Is a Puritan type of repertory. But I am so many times I opened the Knerr repertory, but then related to the typographic markings, I'm not interested to read the rubric. And then so many difficulties we are facing while opening that Knerr repertory. So many difficulties we are facing while reading. But this textbook, this is in front of our table. I'm just trying to open a page. Let my surprise that page open to show that particular page related to temperature wise, their specific medicine they are mentioned there. The temperature 104.2, a particular medicine is there. 102.8, another Fahrenheit, another medicine is there. Likewise, more than 55 temperature not related to rubrics we are work out in that repertory. And then again, according to my academic interest, I'm going through the different pages. Then almost all the pages, the physical examination related rubric, I am able to work out. Therefore, I am more interested to study this Knerr repertory. In my day-to-day practice, I am around 40 to 60% of cases I am using this repertory. Therefore, I am like to highlighting the role of the Knerr repertory. Knerr repertory is emphasized homage to Calvin B. Knerr. Listen here in that repertory. This time I am showing the reversed edition by Shivaramakrishnan. He is just in reversed edition. The Kendian method, Kendian chapters there, that method they are used. What is an advantage of the Kendian method they are followed in that repertory? Then almost all the homeopathic doctors are familiar to the methods, the Kendian chapters. Therefore, our Shivaramakrishnan is reversed into that particular book into reversed edition. He is follow the method of Kendian method they are followed. Okay. Then listen here. Then roll off the physical examination rubric I am work out in that repertory. The percussion sound. Listen, number of rubric is there. The dull circle size palm of a hand is a physical examination finding. The skill, only one medicine is a skill. Look here, percussion sound, dull sound over a large surface at base with the plastic exudation. In organic affection, only one medicine is there. It's a percussion sound. Then auscultation related rubric. Look here. There is an original book of Calvin B. Knerr. This one is the reversed edition of by Shivaraman. Is by Calvin B. Knerr textbook, the repertory of the hearing aiding symptom of our Materia Medica. The first one is the original textbook. The second one is the reversed edition. Then is a type of concordance repertory. Is an alphabetically index of the principal word of a book or a work of an context. Is a concordance repertory means repertory is based on the arrangement of is the original edition. The title of this repertory is Repertory of Hearing Aiding Symptom of Our Materia Medica by Calvin B. Knerr. Published in 1896, is a Puritan type of repertory. Is a philosophical background of this repertory is based on hearing aiding symptom of Materia Medica. It emphasizes on concomitant symptom, the quality of the guiding symptom. This is a philosophical background. The plan and construction, the book is divided into 48 chapters. The beginning from mind to end in drug relationship. There is around 4 medicine with a complete list of their abbreviations. That is in plan and construction. Then order of arrangement and method of classification is one given by Hahnemann. The developed, perfect and used by Hering throughout his entire work. The anatomical and regional division with the 48 chapters. Then each chapter is divided into section. There are inner head 9 section, apoplexy, brain, all are in alphabetic order. Therefore, we are easy to work out. The region wise, we are easy to work out. Brain, forehead, head, headache, occiput, parietal temple, vertex, like this. Alphabetic orderly, they are maintained. The alphabetic arrangement of the section of each chapter. Therefore, easy to work out the anatomical area. This is another advantage. Then under the each section, the word is repeated before in each rubric. It's another advantage. But then other repertories we are referring, then main word is and first only there mentioned. Then before the sub rubric, they are not mentioned the main word. But it's not like in our Knerr repertory. Knerr repertory, the word is repeated. The main word is repeated before each sub rubric. That is another advantage. Then apoplexy chest, then apoplexy in drug guard, then likewise. Then before the sub rubric, then again the main rubric is added. The chapter is added or section is added. Okay. Then rubric and sub rubric is also again alphabetic order. Then rubrics are given in the same word as expressed by the prover and patient. This is the main advantage of the Knerr repertory. All the symptoms are the prover symptoms. The prover says the words they are used in their repertory. The same word they are used in the repertory. The time what is an advantage? The same word we are seen in a particular patient. That basis we are able to select the homeopathy medicine. If the same word is there, that medicine acts as a remedy, no doubt. Then again, keywords and subrubrics are given alphabetically. It's another advantage. The name of the chapter along with the number is given to the top of the each page. Then after the chapter name, the important section is written in big letters. The look here is an original repertory, one of the page. Then one of the chapter is a respiration. Then alphabetically arranged asphyxia, then asthma, then breathing. A, B, D, E, I. Yes, that means alphabetically arranged. Then asphyxia, the number of rubric is there. Then listen here, in right side, asthma abdomen, asthma breathing. Then before the subrubric, the main chapter also mentioned there, or the session also mentioned there. Then here the session is asthma, asthma bronchial, asthma breathing. Listen, one of the advantage. Then each page is divided into 2 columns. The section word is repeated down to the column till the end of that of section to avoid the confusion before each rubric. So look here. Then 2 sessions are there. Before the sub-rubric, that session also mentioned there. Therefore, while reading, there is no any confusion. Okay. Then generality chapter is missing here, but the journals are split into many chapters. That is included under sensation in general, rest, position and motion, stages in life. One of the chapter is there. One of the chapter, a big chapter, this is another advantage of its repertory. For the study of the temperament and one of the component of the constitution, the temperament studies, this chapter, the stage of life and constitution is help for you. That's another advantage of this repertory. Then different typographic markings are there. In Kent and Walker Bonnierson, typographic markings everybody know. But here, one limitation, you are not able to arithmetically calculate it. But the typographic markings are like this: 2 thick bold, repeatedly verified symptom. 1 thick bold, symptom verified with the QRs. Then small, then thin 2 lines. The symptom are more frequently confirmed or it but not confirmed. Strictly in character with the genius of remedy. Then a single thin is a occasionally confirmed symptom. The look here, this is a typographic marking. In reversed edition also is converted into. Then it's an original book. The typographic markings we are already conveyed with you. But at the same time, in reversed edition, in Shivaramakrishnan test book, this is converted into 2 double thick is converted into bold capital. Single thick line is ordinary is converted into capital letters. The 2 thin double line is converted into bold Roman. The single thin line is converted into Roman italics. Then again, 5th one is the ordinary Roman. Okay, these are the typographic markings. Is in original repertory and in reverse edition of the Shivaramakrishnan. In Shivaramakrishnan, all these lines, the double thick, single thick is changed to respectively bold capital, ordinary capital, bold Roman, Roman italics, etc. Is the typography in change to Kentian pattern with the mark. Why the Shivaramakrishnan is changed to this typographic markings? The reason is their chapter is based on, while reverse edition, the Kentian method is pattern is followed. Okay, therefore the typographic markings are changed to bold capitals, bold Romans, etc. The listen in original repertory, the typographic markings is like this: single thick bold, double thick bold, etc. We are already discussed. These are considered as vertical lines. Then different other sign also seen there, like 3 dotted. 3 dot is indicated observation drawn from the old school. Madam, then another 10 minutes more is allowed. Another 10 minutes, please.
Definitely, sir. Definitely, sir.
Okay, thank you. Then sharp 9:45, I will stop it. Okay.
Definitely, sir.
Okay. Then because already we are 10 minutes late due to the technical issue. Therefore, then 9:15, I will stop it. Okay. Then T indicated is the toxicological extract, and theta, another sign is there. Theta is the standing between the cured symptom and the pathological symptom. Okay. There is another few marking is there. Just trying to read all these things, but this time I am not able to complete all these related signs and its finding. Then advantages, just I will discuss with you. Based on concomitant symptom, everybody know what is the role of the concomitant in our day-to-day practice. It's the right characteristic. There is no any direct relationship with the common pathology. Okay. Then include symptom and remedies from clinical proving and toxicological pathogenesis. Then again, symptom in the original form. That is, prover says the same language here used in this repertory. These are the advantages. Then errors, the converting the patient symptom into rubric can be avoided. Then reliability of the rubric and remedies is double ensured by repeated verification and observation is another quality of this repertory. The word right and left, better and worse, etc. are printed into full to avoid the possible error. The large number of cross-reference is another advantage. The disadvantage also, like other repertories, this repertory is also so many disadvantages. It is used in overly complex and graphically layout. Therefore, very difficulties we are faced while reading. Then, as a no grading in mark, not useful for arithmetic calculation. This is another disadvantage. But I say is another advantage. Because the arithmetically we are calculated, the highest number is there, we are considered as a remedy. But exactly is wrong. Therefore, here we are arithmetically we are not able to calculate. Then third one, the number of remedies is less, need of upgradation. Okay, this is disadvantage only 408 medicine. Okay. Then symptom under each rubric is said to follow the alphabetic order. Then, but many typographic errors are also there. The type of alphabetic arrangement, it is very difficult to find out of the sub-rubric. Then one more thing, the last point I would like to highlight it. Then almost the sub-rubric start with not a particular word, a sentence-wise we are starting. Then, for example, I would like to highlighting. Moreover, this arrangement of paragraph style. This is the patient. Likewise, the start with the, is, like that. It is very difficult to find the exact symptom without the considerable loss of time. Even we are completely read that paragraph, that time only we are able to work out right sub-rubric. That is another disadvantage. But again, I say this is an advantage because while writing this paragraph, that time only we are able to correlate it with the patient language. Okay. Then all the disadvantages, I am trying to convert it into advantage. Okay, this is an augmented reverse edition of Kalpinbi Shivaramakrishnan. This new edition version construction is changed to Kentian method by Shivaraman. Here the 48 chapters are rearranged to, in Kent everybody know 37 chapters. Therefore, instead of the 48 chapters, is rearranged to 37. And anatomically and alphabetical order are retained. And too much apologies to the repertory teachers. Supposed to be this webinar, the repertory teachers are there. I am really apologies because the original edition I am not able to discuss. That means your reversed edition I would like to highlight it here. But therefore is not tolerate the exact repertories. Therefore, I am really apology to you. But I am very interested in this particular reversed edition because I am always know about the one repertory is in Kentian method. Then Kentian method is in converted. I am easy to refer this Shivaramakrishnan new reversed edition. Therefore, I am attracted this reversed edition. I am not 100%. I am not accepted that one. But at the same time, but I am very easy to refer the this repertory. Okay. Then supplement also published along with the main repertory containing easy to handle the real reference. Then look here. Then a comparison of Knerr repertory and Kentian method we are converted. Kentian repertory. Here chapter is 48. There 37. In Kentian repertory, too much medicine is there. More than 200 medicine additionally there. But in our Knerr repertory only 408 medicine. Sub-rubric more. Chapter of number on top. Original words of the prover, selection of below the chapter, certain rubric present. But in disadvantage, the same, these advantages are not able to see in our Kent repertory. That means chapter, original words, then selection, everything we are not seen in our Kentian repertory. These are the modern repertory. This is a comparison of chapter wise. I am compare then original Knerr and Shivaramakrishnan chapter. Shivarama is converted into Kentian chapters. Okay. Then the few cases I would like to discuss with you. Then here, with the help of this repertory, I am able to select the right homeopathy medicine. A case, patient 24 residing at Kulashekaram, 6-month pregnant, came with the complaint of palpitation, cold of extremities, anxiety, the tiredness, vertigo, and sweat around the forehead. The heart rate is exceeding 205. Look here, is a tachycardia. Tachycardia is changed to a type of arrhythmia, the sinus arrhythmia. It's very difficult to maintain, but that time the heart is at 205. The sometime is changed to a type of arrhythmia, SVT, supraventricular tachycardia. Then tends to ventricular tachycardia. Then JVP also slightly raised. The look, then heart rate is more than 205. Just my surprise, I am work out then now I am just to see a particular page. Then pulse wise, they are prescribed the number of medicine here mentioned there. Then one chapter, chest pulse. Pulse is almost equal to the heart rate. Therefore, accelerate fast, frequent, more than 200. The listen, in Knerr repertory, one medicine is mentioned there. Is the look here, this chapter, then you start from 89, one medicine is there, 90, then 128, 130, 140, 143, 144, 150, 160. Listen, more than 200, one medicine is mentioned, Chininamas. And just my academic interest wise, I select this Chininamas for this child, this lady. The look here, next within 1 hour, the next ECG shows the heart rate is gradually reduces 120 beats per minute. At that time also the classical sinus tachycardia is an exceeding more than 100. The P wave followed by QRS complex. The P wave is inverted in AVR. P wave is an upright in lead 2. At that time here says is declared is normal sinus rhythm. But only one finding, the exceeding the heart rate is more than 100. Okay. Then again, we are waiting. Then within short time, the patient is turns to normal, 119. The next, the patient is reached to the heart rate is 72. Okay, this is one of the finding. Then listen here. Then another umbilical hernia. Then our neuropathic help for me is a selection of abdominal hernia, umbilical, accompanied by constipation in newborns. There is only one medicine is there, Nurse Mosqueta. It's wonderful. Within 14 days, within 7 to 14 days, that almost the 90% is disappear that hernia, umbilical hernia. Okay. It's a case of subacute appendicitis. Then a 16 years old male, then finally the pain get aggravated during pressure while passing urine and relieved by flexing his right leg towards the chest. Look here, this video help for you. It's an appendicitis. Look the face of the patient. The boy always flex their right knee, but the left leg is extended. But I am asking why you are flexing your knee. He says, otherwise the pain is aggravated. Look here. The only one medicine, the beauty of our repertory, then chapter abdomen, intestine, cecum, then typhlitis means one of the other name of our appendicitis, typhlitis, deep circumscribed swelling, lies on back with the right knee drawn up. Look here, it's the language of the patient. There is a finding. The classical word is the classical, the patient presentation we are seen in our case, seen in our materia medica, seen in our repertory. Cecum, typhlitis, deep circumscribed swelling, lies on back with the right knee drawn up. Only one medicine is there per self. The look there, both report within 4 days. Then first subacute appendicitis. Therefore, the doctors are advised the surgery. Then, but the patient is not willing. Then the next ultrasound shows there is no any appendicular mass or the probe tenderness. Then patient is absolutely free from appendicitis. The look here, one day, then one of our intern is suffering from dyspnoria. The look here, the girl with the help of her right leg, so just look here. It's a presentation. Another rubric we are in Mediterranean, we are fine. Drawing up knees with the bearing down, labor-like pain, with the pressing of feet against support as in labor. The like, the repertory dyspnoria, one rubric is there. Like bearing down, labor-like pain. That is indicated the intensity of the pain. Here prescribed the medicine is the Mediterranean. Then after within 15 minutes, that is girl is okay. The completely is in sleep well. The line to sleep well. The characteristic symptom also disappear. If you are selected right homeopathic medicine, the characteristic symptom also disappear. Look here, a case of a sinusitis with a bronchitis with a high rise of temperature. A child in clinical studies presentation always keep one towel in his hand. Then inside the towel, he keep ice cubes. Just ask the patient why they are using this one. He is always, with the help of this towel, he's wipe the ice for the coldness. Then next day itself, the patient absolutely normal. The normal vigil is maintained. Is the rubric, the related rubric we are select to pulsate lab. It's a case of vertigo. As then during the time of the patient is an irritable and constantly moaning in every breath. It's another case of an emergency department. I admit a case, the presenting on feature. It's a hypoglycemia case. It's a helliborous. Always he is move her head, helliborous. The look here, a child. The look here, mouth always pouting. The presentation is will help the lip out. One of the medicine is the antimonium powder. The next day itself, the child is absolutely normal. Okay, the characteristic symptoms are disappear. Okay. Then another case of cervical spondylosis. Look here, another case. A 5 years old female child presented with fever 103. That rubric wise we are selected Pulsatilla 200. Remember 3 drugs, nanocarb, stramonium and lycopodium. That is okay. Okay. Perfectly okay. Then so many cases in my hand. The time is over. There is a case of then an inguinal hernia. This I will show you another case. As I look here, it's an antimonium tartaricum. It's a case of bronchopneumonia case. The drooping of eyelid. Okay, this observational symptom wise here selected is antimonium tartaricum. The next day is a bronchopneumonia. Next day itself, the child is absolutely normal. The rapidity, gentleness, and permanence. Okay. It's a look the face, absolutely normal. Is another one case. Any case in my hand. It's a case of appendicitis. Typhlitis, deep circumcised swelling, lies on back with the right knee drawn up. Okay, look here. It's the first time I see look this video. It's a case. The looks the child flex their knees towards abdomen. Okay, this and look as an Repertory. Infantile left side, better by thigh flex on abdomen. It's an absolutely normal. It's an cellulitis case. Okay, thank you for all. For eagerly, we are just to attend this particular session. Then role of the physical examination and in our day-to-day practice, the role of the utility of our Knerr repertory. Let my conclusion: the Knerr repertory is a powerful tool for connecting the physical examination, that is the clinical examination finding, with remedies, then especially when dealing with rare or characteristic symptom. Then second one, while it requires the practice and expertise to use effectively, it is detailed symptomatology and grounding in hearing guiding symptom make it an invaluable resource for advanced homeopathic practitioners. Therefore, you are youngsters, then supposed to be these seminaries and attending youngsters. Therefore, the properly right way you are utilize this repertory, you are in the practice, you are able to show the miracles. Then moreover, never neglected the physical examination, the never neglected during the time of physical examination. You are work out the symptoms, you are trying to convert it in the language of the materia medica. These are my requests. Once again, I extend my sincere thanks to organizers. Give me an opportunity to present a topic in front of you, that means in this particular session. Thank you all.
Thank you, sir. Thank you so much for enlightening and enriching us with this wonderful session. It was quite knowledgeable with all the details, and each and every minute details